Hemophilia is a rare disorder disease in which a person bleeds excessively. It is an inherited bleeding disorder. Blood does not clot properly. Causes: it is a disease which is present in male. It is a sex-linked recessive. In this disease only male person suffers, but in female there are rare chances. Female is the carrier of hemophilia. As we know that male have one X chromosomes, mother, and one Y chromosomes, father, whereas females possess two X chromosomes from each parent. X chromosomes have many genes which are not present in Y chromosomes. It means that male have one copy of genes on X chromosomes whereas female has two copies. Thus male can have hemophilia if they inherit an affected X chromosomes. In other words, a woman who inherits a chromosome and abnormal factor gene will carry hemophilia. They may not have symptoms, but they can pass the condition on to their children. There is a 50% chance that any children they have, boys or girls, will inherit hemophilia. Boys who do inherit hemophilia are more likely to have severe symptoms. That's because they don't get a healthy X chromosome from their father. Types of hemophilia: there are three types of hemophilia. Hemophilia A, classic hemophilia, lack of clotting, factor 8 deficiency. Hemophilia B, Christmas disease, lack of clotting, factor 9 deficiency. Hemophilia C, Rosenthal syndrome, factor 11 deficiency. Symptoms: it occurs when clotting factor is missing low. In this disease there is an excessive bleeding after injury. The bleeding may not stop. The bleeding problem may not be present at birth, but this problem comes slowly by the time the child is 3 to 4 years old. The person might have internal and external bleeding, i.e. internal bleeding stomach, joints, muscles, brain, etc. External bleeding nose, sputum, mouth, stools, urine, etc. Diagnosis tests: doctor will start with complete medical history, family history, physical examination and certain tests like CBC, complete blood test to check blood cells. PT test, prothrombin time test to check time of blood clots, C.T clotting time. APTT test, activated partial thromboplastin time test, measures how long it takes for blood to clot. It measures the clotting ability of factors 8, 9, 11. If any of these clotting factors are too low, it takes longer than normal for the blood to clot. Specific clotting factor tests. Blood test show levels of specific clotting factor levels, factor 8 and factor 9. Treatment: there is no known cure, but to treat hemophilia is to replace the missing blood clotting factor so that the blood can clot properly. This is typically done by injecting treatment products, called clotting factor concentrates, into a person's vein. Healthcare providers use technique called immune tolerance induction, ITI. ITI involves clotting factors given on a daily basis to bring down inhibitor levels. ITI may be a long-term treatment, and some people may need this treatment for months or years. People having hemophilia: exercise daily. Have good dental hygiene. Manage stress. Get vaccinations. Avoid risky games. Keep first aid handy for minor cuts. Physical therapy, etc.